What is the intersection of feminist and environmental bioethics? Have you ever wondered how gender issues and environmental concerns connect in the field of bioethics? The intersection of feminist and environmental bioethics provides a fascinating perspective on this topic. Both areas focus on how social structures and power dynamics affect human health and the environment. They examine how inequalities related to gender, race, and class shape medical research and healthcare delivery. Feminist bioethics critiques traditional bioethics for overlooking gender-specific issues. It highlights how systemic inequalities influence ethical analysis and healthcare practices. On the other hand, environmental bioethics emphasizes our ethical responsibilities toward the environment. It recognizes that human health is closely tied to ecological health and sustainability. At this intersection, we find ecofeminism, which links the oppression of women with environmental degradation. Ecofeminism argues that both issues stem from patriarchal and anthropocentric worldviews. This perspective challenges traditional environmental ethics for ignoring the social contexts of environmental harm. It calls for inclusivity, diversity, and justice in environmental decision-making. This combined approach encourages healthcare systems to consider the health impacts of environmental degradation. It also addresses how environmental policies disproportionately affect women and marginalized groups. For example, menstrual health and period poverty are related to both environmental and social justice concerns. Practically, this intersection urges healthcare ethics to focus on environmental sustainability in medical practices. It promotes equitable access to healthcare resources while recognizing gendered environmental health burdens. Healthcare systems are encouraged to reduce their ecological footprint without limiting women's healthcare choices. Incorporating key medical ethics principles such as justice, autonomy, and non-maleficence is essential. This approach fosters an awareness of gendered social inequities and environmental sustainability. By integrating these frameworks, healthcare can be socially just and ecologically responsible. Understanding the intersection of feminist and environmental bioethics reveals the complex ways human health, gender, and the environment are connected. This perspective encourages us to think critically about how we approach healthcare and environmental issues together.